10,000 of them had chronic disease. That is end of it, where now they need what we call dialysis and even transplant.
Yes.
Out of these 10,000, only 10% could even afford the services or could access services. We are talking of 72 facilities across the country, both private and public. That's how serious it is. With that 4,000, you know, when you talk of 4,000, more than 4,000 lives, it's more than 40 buses crashing.
And once, isn't it? Mm-hmm.
Let's assume that a bus has got about 80, for example.
Yeah.
That's more than 50 buses crashing.
Crashing.
Yeah. That's more than 4,000 people.
In a year.
Yes.
Even if you distribute it every other month.
Correct. 50. That's how serious it is.
That's putting a face behind those numbers, isn't it?
Oh, yeah. 50 buses are crashing to make that 4,000 people. These are not just statistics. These are people who have died on something that we could have prevented and protected.
But just before I see exactly where you are with Amref University on really being part and parcel of this conversation, there's a number again. There's something that WHO highlighted in this number. And they said this: if you look at most developed countries, that's where majority of people who suffer kidney diseases are. But then they said most developing nations now are also accelerating the number, accelerating in number in terms of the people who are also at risk of suffering from kidney disease. Could you put that into perspective? Why is it that in affluent economies, that's where you get majority of these numbers? And why is it then that Kenya, as a developing nation, we are also at risk of increasing this number, the 4,000 that we got in 2020?
Thank you. Let's put that in perspective. Yeah. Number one, what are some of the risk factors to kidney diseases? And we'll understand why the developed and the developing nations are struggling with kidney diseases.
Yes.
Number one is high blood pressure. It's across the nations. Across the nations. And it's a silent killer. High blood pressure. And you won't know. What we know is that high blood pressure is one of the most risk factors to kidney diseases. Number two is diabetes. Both type 1 and type 2. It's a big problem in all the nations.
Yes.
Number three is cardiovascular diseases. It's a big problem. Number four is overweight. People are struggling with weight across the nations. And most importantly, exercise. Most of us are so busy. Both nations, people are busy. They rarely exercise. And these are the risk factors to kidney disease. But let's not also forget COVID-19. Mm-hmm. COVID-19 made it even worse in terms of all the nations, both developing and the developed. But the only difference is that in developing nations, Kenya being one of them, access to health is a big problem.
Awesome.
And let's not forget, our constitution is so specific in chapter 43 and says everyone has got a right to good health. And the same is also captured in Sustainable Development Goals. But let me also say, in 2015, kidney is one of the NCDs, that is non-communicable diseases. At least in Sustainable Development Goals of 2015-2030, it has been recognized. And we are saying that by 2030, we need to reduce the number of NCD deaths by a third. Will we do that? We don't know. Why? Look at the number of people that are smoking. Smoking is one of the risk factors to kidney diseases. Okay? And of course, family history. At one time, if any of your members of close families had kidney disease, what we are saying is that you are at risk of getting kidney diseases. Okay? Therefore, it basically means that it's a multifaceted of a lot of things that then causes what we are calling this kidney disease. But kidney disease as a disease is so easy to deal with when known early. One thing about kidney disease, as I said earlier, is that you can't know the symptoms. By the time the symptoms come, you're already in step 3, step 4, or stage 5 of it.
Isn't it, by the time you're feeling the symptoms, you're already deep within it.
You're already deep with it. That's the problem.
So the only thing that you got to control, and that's why it's a bit tricky, as you're saying, is the risk factors, isn't it?
And going for tests. Going for tests. Okay? It's important that you always go for tests. And more so if you know that you're at risk. For example, if you've got cancer, let's say prostate cancer, for example. Or you've got the kidney stones, for example. Or you've got high blood pressure, you've got diabetes. It's important that then, meaning you're at risk of getting a kidney disease. Therefore, it's important that you always go for tests. And they do a special test. For example, in creatine, they look at blood, creatine in the blood, and protein in the urine, as a way of knowing whether you are suffering from kidney disease.
Yes.
And kidneys are but the kidney is a very small organ. It's like is a mouse. If you know how a mouse, you know the shape of a mouse, that's it. It's that small, but very important. It removes the toxins in our body. It removes the excess fluid in our body. And basically, if your kidney is not functioning well, meaning you've got a lot of fluids within your body, among them lungs, what will happen is then you'll have a lot of swelling, for example, in your ankles. Those are some of the telltale signs that something is going wrong.
Yes.
Urinating frequently or not frequently. It's a big issue. Vomiting, nausea. And if you look at some of these symptoms, they're more or less the same as other diseases. And therefore, people, in most cases, by the time diagnosis takes place, and you know, the way we are, where we come from, the level 1, level 2, level 3, there are only 72 facilities that you can get dialysis and better treatment as far as kidney is concerned across the country, both public and private. Yes. And you're talking of 4 million people.
Against 72.
Look at that. 72 facilities, both private and public. But do not forget that private is about how much you have in your pocket.
That's it, by the way. It's not affordable to every other person.
No, it's not. Even public itself. Even public, it's not.
Dialysis is essentially not heavily covered under NHIF.
No, it is.
Yes.
The only problem with kidney and dialysis is, in most cases, actually people go for dialysis because that is the only thing that is covered by NHIF. Transplant is not covered by NHIF. And whenever you've gone for transplant, basically means that you live in medication forever. And because NHIF does not cover, and I want the viewers to understand this, NHIF does not cover transplant and treatment after transplant or taking care of yourself after transplant.
After transplant. Yeah.
So most people don't go for this transplant. Most people then go for dialysis because that is now what is being covered by NHIF.
Yeah.
But even just having a dialysis machine, most public hospitals cannot afford because of the consumables that we need as far as dialysis is concerned. The consumables are very quite expensive. You must have a water plant in some of these institutions. Okay? And therefore, even public hospitals, in most cases, like for example in Kisumu, there's only one public hospital in the name of Jarim Omogi Referral Hospital.
So that means that if you are a patient in Kisumu and you want to get treated or go for dialysis
in a public hospital, it's only Jarim Omogi. It's only Jarim Omogi.
Whoa.
Oh yeah.
Whoa.
Yes.
For a disease that beats accidents in this country annually.
Correct.
Let's go back to what WHO is saying. That those who are at high risk of fatalities are, number one, and let's look at what they're saying. That the prevalence of chronic disease, that is in Africa entirely, before we look at Kenya, it is 14%. Now listen, in Kenya, it is estimated at 4%. Now, according to a population-based study of this one in East Africa, the prevalence in Western Kenya alone, 4%.
Look at the population in Western Kenya.
As a scholar, when we are talking about the entire prevalence being 14%, and then one region contributes the entire percentage, that is the average in the country, that's a 4%, what does that speak to? Is Western Kenya essentially a chronic disease, a chronic kidney disease region in this country?
Let me break that number
to
our viewers. 40% means
Yes.
out of 100 people, 14 have got kidney disease. That's basically what it means. If you take 100 people in a room, 14 of them are with the disease.
Whoa. Whoa.
When you talk of 4% in a region, look at the population in Western Kenya. Then do that by 4%. If there are, let's say, 2 million people, for example,
Yes.
out of 4%, yeah, 2 million, we're talking about 80,000 people. Just like that. We would say that Western Kenya is manifested, for example, by chronic disease. We would say that.
Yes.
But we would say there must be something that the Western Kenya counties have done in terms of, for example, a number of diagnoses that is taking place.
Exactly.
And let me say also that a lot of kidney diseases currently are being known because people now are going for tests, number one. Number two is that other diseases, when they manifest, doctors know that, hey, let's test 1, 2, 3 about you. And maybe at that time, it was a targeted and a number of tests were done as far as kidney is concerned, and that's where they came up with that number. But look at Nairobi. We don't know about Nairobi. Just like they say high blood pressure, the prevalence is about 4% in Kenya. 4% is only those that have been tested. That 14%, I can tell you, that we are told that World Health Organization is talking about, that number could be more. Most people are walking in town here. Most people are walking in our streets with this disease unknowingly. They will only know when the signs are coming out. But a number of us are walking with this disease unknowingly.
Let's go back a bit to Amref then. Would you talk to me about how you find yourself in this conversation of kidney disease awareness, and especially these days, speak to exactly what you're doing. Could you give perspective into how Amref finds itself in this conversation?
Amref International University is a Pan-African university.
Yes.
That we are geared towards purely health training. And apart from just the clinical part that we train in our School of School of Health Sciences, we also train community health workers in the School of Public Health.
Yes.
And we also train health systems managers in the School of Public Health. The